On January 21st, 2020, most of the world would begin to hear about the coronavirus, which later would be declared a pandemic by the World Health Organization. At this point in time, the virus has already claimed numerous lives in China and many other countries. It is strongly believed that China, which is the epicenter, knew as early as November of 2019 about the virus. Dr. Anthony Fauci, immunologist and head of the U.S. National Institute of Allergy and Infectious Diseases, stated that the disease could not be passed from human to human. This was based on information he received from China.
There, Miguel, thank you. Tonight, a warning that a pandemic is likely. It comes from one of the government's top health officials who has spent much of his career on the front lines of outbreaks. Richard Engel spoke today with Dr. Anthony Fauci.
At Washington's National Institutes of Health, America's top virus control official, Dr. Anthony Fauci, says the coronavirus is spreading and America may need to take drastic actions.
What are we dealing with this coronavirus, COVID-19?
We're dealing with clearly an emerging infectious disease that has now reached outbreak proportions and likely pandemic proportions.
How lethal is it?
So right now, if you look at the people who just come to the attention of the health authorities, that's 2 to 2.5%. But even if it goes down to 1%, that's still very, very serious.
So serious, worldwide, the flu, which we've gotten used to, kills 300 to 650,000 people a year. That's just 0.1% of the people it infects. Coronavirus, even if low estimates are correct, appears to be far more deadly.
So if it went from 2% to 1%, you were still 10 times more lethal than the standard influenza that we get on a seasonal basis.
People are scared. Right. When you ride the subway and somebody coughs right now, you can see the fear on people's face. Are they right? If somebody's coughing on the bus, should you get off?
No, getting off is not going to help.
What about sporting events? What about concerts?
We're not there yet. But if and when we do, and it may be when, because we're seeing a lot of community spread, we need to be at least thinking about the possibility if we get a major outbreak of this coronavirus in this country. That would mean perhaps closing schools temporarily, getting people to do more teleworking, canceling events where there is a lot of crowds in confined places, canceling unnecessary travel so that you're not on an airplane for 5 hours with a bunch of people who might be infected.
That would be a huge step. It would have enormous economic, societal, psychological implications.
It would, but it would be temporary, but it would be necessary.
There are people who are shrugging this off, saying, it's just like the flu.
It's not, because it's brand new. When you have a brand new virus in which no one has had any experience before, that gives the virus kind of an open roadway to spread.
Richard Engel, NBC News, Washington.
Some signs yet that new cases are slowing. Health officials cautioning we haven't hit the peak. The new warnings from survivors.
Nobody's safe from the virus. You don't know how it's going to affect you.
On this Easter weekend, the Pope live streaming services, many churches following suit, but some vowing to defy those stay-at-home orders, risking spreading the virus again. Also, the hotspots getting worse, why the White House has serious concerns now about Philadelphia. Detroit reporting its deadliest day in this crisis and the growing impact on families, massive lines at food banks, the urgent and growing threat at nursing homes, and the shocking new toll NBC News has found at facilities across the country. How many are affected? The keys to reopening the economy and the country. Tonight, the 3 critical things that experts say we need, and the dire warning about too much too soon, and the rising alarm at places where your food comes from. New images of workers crowded together, and my interview with a truck driver and war veteran risking his life to keep vital products flowing.
This is NBC Nightly News with Lester Holt.
New warnings on the coronavirus emergency. The Surgeon General sounding the alarm about what's to come as U.S. cases top 40,000.
I want America to understand this week it's going to get bad.
The World Health Organization saying the pandemic is accelerating. More than 1 in 3 Americans now under stay-at-home orders, but some beaches and attractions still packed. Hazmat crews scrubbing down public areas and the growing pressure to postpone the Olympics after countries refuse to compete. Also tonight, where are the masks and protective gear? Desperate pleas on the front lines.
We are given 1 mask a day, and we are reusing that mask throughout the day.
Growing pressure on the Trump administration to stop states from competing for supplies. And a late word tonight from President Trump as the Senate fights over that nearly $2 trillion rescue package that would send checks to Americans. Unemployment skyrocketing, but a boom for delivery workers. The risks they take to bring others food and supplies. The chilling new images from Europe, patients lying on the floor as hospitals are overloaded. The alarming mental health toll on Americans, the new ways to get help, and what to watch out for, the unusual new coronavirus symptom.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. Tonight, we are struggling to isolate the hope somewhere inside this horror, but it's hard to get past the numbers like we saw reported in New York State today, recording its highest single-day death toll from COVID-19, 731. But even as this virus kills and sickens in communities across this country, there are slowly emerging signs of encouragement in places that some of what we're doing may be working. Let's turn to our team on the front lines now, starting with Gabe Gutierrez.
With New York hospitals pushed to the brink, the state's coronavirus death toll had its largest single-day spike yet. 731 people died in just 24 hours, one about every 2 minutes.
Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
But there's some encouraging news. Governor Andrew Cuomo is now projecting that New York is reaching a plateau. The average number of hospitalizations is going down.
The 3-day average is down, which is good news.
Still, aerial images from New York City show not everyone is properly social distancing.
We must continue those strategies if we're going to protect lives.
So far, only about 50 patients have been treated on the U.S. naval ship Comfort. A crew member there has just been isolated after testing positive for the virus. Now, one of the largest churches in the world, the Cathedral of St. John the Divine in Manhattan, will turn into another field hospital to relieve the pressure on doctors like Nicholas Hernandez at Northwell Plainview Hospital.
We're pretty much putting out fires wherever we can.
Weeks ago, he himself got sick.
You know, I worried about my family. I have an 8-month-old. I had to, be careful with, and tried my best to do everything I could to maintain my distance. But it's still that worry. Am I going to make it through this? Are my symptoms going to get better? Why am I not getting better? It's day 10, it's day 11, it's day 12.
He's now back at work for grueling 90-hour shifts. But over the weekend, his grandfather came into his ICU. He's now on a ventilator.
This virus doesn't discriminate.
For so many on the front lines, it's the battle of their lives.
I felt